4 countries with few vaccine doses. Fighting COVID-19 is a race from behind. Rosalia Indongo wanted to get a COVID-19 vaccine. Then, her country, Namibia, ran out of doses. And then she got sick. While the United States and a handful of other countries are already offering COVID-19 booster shots, healthcare workers in dozens of low-income countries haven't yet had a first dose. A nurse by training, Indongo, 56, oversees a healthcare nonprofit in Windhoek, Namibia, that works on healthcare policy to improve outcomes for HIV patients. Since the pandemic's arrival, her team has shifted their focus to the coronavirus and what can be done to slow its spread. Due to heart health complications in May, Indongo said she missed a chance to get vaccinated with either AstraZeneca or Sinopharm, which was developed in China. Namibia then stopped distributing vaccines. They had used up their stock. A few weeks later, the sub-Saharan nation experienced a surge of cases, and an outbreak occurred at Indongo's office. She became so sick in early July that she was hospitalized for 17 days, 10 of which she needed to receive oxygen treatment. Today, Indongo remains unvaccinated and hopes that medical issues linked to her COVID-19 infection do not prevent her from getting her first shot later this month. While Namibia has amassed one of the highest reported COVID-19 death tolls in Africa, and experts say that's likely an undercount, an estimated 92% of its population is still unvaccinated. The dangerous trend is fueled in part by vaccine hesitancy, but also due to a lack of supply. Everything is being grabbed up by the wealthier countries, Indongo said. The coronavirus pandemic has laid bare wide disparities in healthcare between countries on issues like vaccines and raised calls for more resource sharing to save lives. Almost 24 vaccines exist worldwide, but high-income countries, home to less than half of the planet's population, hold 80% of all doses, according to the World Health Organization. One estimate suggests that a quarter of people worldwide are fully vaccinated, but fewer than 2% of people living in low-income countries have received a single dose. That disparity is fueling the pandemic, said Dr. Kate O'Brien, the WHO's Director of Immunization, Vaccines, and Biologicals. File photo, World Health Organization Director General Tedros Adhanom Ghebreyesus admonished high-income countries for prioritizing COVID-19 booster shots over donating vaccine doses to COVAX. Photo by Fabrice Cofrini/Pool via Reuters. Last month, the WHO called for a global moratorium on COVID-19 vaccine boosters until at least the end of September. That would give each country enough time to vaccinate at least 10% of their population, according to the WHO. It's unconscionable that some #COVID-19 vaccine producing companies are reporting record profits, and some countries are offering boosters, while so many people remain unprotected, WHO Director General Dr. Tedros Adhanom Ghebreyesus tweeted on August 17. No one is safe until everyone is safe. President Joe Biden has pushed back against this criticism, saying the U.S. pledged to donate 600 million vaccine doses to COVAX, an initiative designed to improve global vaccine access that is overseen by the WHO, Coalition for Epidemic Preparedness Innovations and others. He also said the U.S. has given more vaccine to other countries than every other country in the world combined. We can take care of America and help the world at the same time, Biden said during a speech in mid-August. But those doses are not getting to the people and countries who need them fast enough, said Dr. Tom Frieden, former director for the Centers for Disease Control and Prevention, who leads the global health initiative called Resolve to Save Lives. Since mid-April, Namibia has received roughly a fifth of its allocated 108,000 doses of AstraZeneca vaccines from COVAX, according to Gavi, the Vaccine Alliance. While more than 5 out of every 10 people in the U.S. are fully vaccinated against coronavirus, in India, which produces most of the world's vaccine stock, fell, the number is 1 out of 10. And across the African continent, fewer than 3% of the population has been vaccinated, Dr. John Kengasong, a virologist who directs the Africa Centers for Disease Control and Prevention, told PBS NewsHour correspondent William Brigham on Tuesday, adding that he has not seen the science yet that justified boosters. The lack of global vaccine equity is problematic both ethically and epidemiologically, Frieden said. The longer there is uncontrolled spread anywhere in the world, the higher the risk that there will be even worse variants emerging, Frieden said. File photo: a health worker wears protective clothing as she prepares for testing travelers for the coronavirus disease amid a nationwide COVID-19 lockdown in South Africa. Photo by Sifilisa Biko/Reuters. Each time someone gets sick with the coronavirus and infects another person, that gives the virus a chance to mutate. It's a biological gamble that could make the virus weaker or stronger. Unchecked infections allowed the Delta variant to emerge, which is far more transmissible than the original strain. When vaccines are used with other health measures, those transmission chains stop, especially when most people within a community have gotten their shots. The vaccines have their best chance at having maximum impact on protecting against disease and death when they can be rolled out to achieve a population level of immunity without pressure from the virus on the vaccine, O'Brien said. Until more communities have broader access to vaccines, O'Brien said it is too soon to take our foot off the pedal by relaxing COVID-19 restrictions even in nations with higher vaccination rates. Laboratory workers supervised the production of vials of China's Sinovac vaccine against the coronavirus, produced by the Egyptian company Vaxera. Photo by Khaled Dasuki/AFP via Getty Images. Aside from donating vaccine doses, O'Brien said countries that have enjoyed an abundance of vaccines should also free up supply chains and share technology with other parts of the world to improve capacity to manufacture and distribute doses around the globe. Countries also need to evaluate export restrictions on supplies, key vaccine ingredients and the finished product.
Thank you for watching. Please subscribe